Hello, I am a patient or past patient of Dr. Vincent Ansanelli with the Breast Cancer Center. This video is long overdue. I probably had to redo it at least 3 times, but I'm just going to go for it and whatever. I'm at work, so I'm not really prepared to do this any type of special way, but it needs to be told. I discovered a lump in my breast back in 2013, and the end of 2013, I would say around Christmas time. I actually thought it was something else, like an engorgement from being sick and straining by vomiting, because I've had that happen. So I kind of let it go for a month or so, and then I decided to go get it checked out and see what it was. And in doing so, the oncologist or surgeons where I was seeing wanted to do they did a core biopsy, which I wish I never got done. And I really feel in my heart and my mind that core biopsy, with the amount of blood vessels that it burst through, and it actually spread the cancer cells and made it metastasize in a lymph node in the center of my chest, which developed another tumor later on that I found out. So anyway, when that happened, the wound from the entry of the core biopsy never healed. This is HER2 positive breast cancer. If you're familiar with that, you know it's very aggressive. It grows very fast. It's protein based. And so I was upset with that surgeon and oncologist, and I was upset with the facility, the hospital. So I did not go back to them. So meanwhile, I'm stressing and fretting. This thing is growing outside of my breast. It's bleeding. It's hemorrhaging. I'm putting bandages on. Nobody wants to touch it. I finally get to a breast cancer center, a hospital that wanted to begin chemo. Mind you, I was having medical issues, heart palpitations, and other things, and I did not think that chemo would have been right for me, because it would just break down my immune system and my white blood cells and red blood cells. I was already a chronic anemic, and they had already given me 2 blood transfusions due to me having a heavy cycle, being premenopausal or what. So to make a long story short, I got to do a targeted treatment that only targets Herceptin receptors, or the protein receptors of Herceptin, and that helped. I didn't have the side effects as chemo. It shrank a little bit, but not significant enough where these surgeons wanted to operate and remove this tumor. Mind you, every day I'm changing bandages, I'm bleeding, I'm losing blood, not to mention I'm already low blood. And I went about almost a year doing treatment and different types of Progetta and Herceptin treatments toward this, to shrink this, and they still did not want to remove this tumor. They wanted to just let it go. And I'm like, how much longer can I live like this, where I'm losing blood, I'm sick, I'm bleeding, I can't go anywhere because I have to keep changing bandages. I can actually see the tumor. I took a picture of it before I even knew who Dr. Ansanelli was. At this point, they're considering me stage 4. I'm stage 4. I don't know how or where, what my search was, that I ran into a video of another person's testimony on Dr. Vincent Ansanelli and this CO2 laser treatment. But I started investigating it and researching it, and I decided, hey, this is my shot. I sent the information over to Anastasia in Alexandria, and my pictures and all my reports and my scans and all my hospital lab work and everything. And I dealt with my family to try to raise the money to pay for this surgery. And then we flew out there to New York, and when we got this procedure done, he removed this massive tumor. When I say massive tumor, it was pretty big. It was not like you gotta look for it. It was had already protruded outside. And they removed, they had to have a mastectomy, so they removed my breast, my one breast, the left breast, and within a matter of, I think, an hour and a half, they were done, and maybe not even that long, and I got up off the table right after surgery and walked out of there. And I had family there from New York, who were there, that worked at the hospital, that was amazed that I was done. They had went away and came back, and I was already ready to go. And they said, "You're done, you did it." They couldn't believe it. We went out and had dinner and hung out, and they just could not believe I was walking around after having a full mastectomy. And also having lymph nodes removed under my armpit. They could not believe this, that I was not in pain. I mean, I had some soreness, but I wasn't like in pain. I could move my arm around. I wasn't stiff. I wasn't anything. I went back to work within 2 days. My company couldn't believe that I wasn't taking a leave of absence. I was just doing an intermittent leave just to have treatment. So, I mean, and even the pathology report showed clear margins. That was great. They couldn't believe that. And then, of course, we had to work on the idea of the tumor that was in the center of my chest near my heart and the lymph node. That was not operational. So I had to battle that. Keep in mind, I had this surgery November 2015. I had discovered the lump 2013 at the end of the year. I had went through a whole year of treatment with an oncologist in the chemo center to no resolve. I got this surgery, and then the next year I was doing more treatment to see if they can shrink the one in the center. And it shrunk a little bit, and finally they told me, even Dr. Ansanelli said I should do some radiation. But once again, radiation over my left breast can affect your heart. I was already having a heart problem, so I had to look for some type of alternative method of radiation. So I did 2 months and a half of proton therapy radiation, which is more targeted and precise. It doesn't affect your other organs. So that worked. I just had a PET scan done a month and a half ago, and it showed nothing in the area that Dr. Ansanelli worked on. No signs of any dysplasia, any tumors, nothing in the lymph node areas. He did remove some lymph nodes, nothing there. And in the area in my chest, it had shrunk this tumor down to where they really saw nothing. So I'm only doing a targeted treatment once a month for now, just to make sure that any microscopic cells are not missed. I go on vacations, I go out of town, I go to shows, I go to parties, I take my daughters going to college or on tours to different colleges. I feel fine. I don't have any side effects from any type of chemo. I haven't lost my hair. I'm just wearing a hat because my hair is a mess. I'm just so grateful. I'm so happy, and I just wish that I had known about this before getting to be stage 4. If I had known about this when I was stage 2 or stage 3, then I probably would not have had to get a biopsy that made this spread. Because Dr. Ansanelli, he does biopsies, and I could have did that if I'd known about